Good day, everyone. It is me again, Dr. Ibe Nathans, your platform medical advisor. We have talked severally on how serious this COVID 19 is. We have talked on the need for us to strictly obey and adhere to the instructions of staying at home in isolations and social distancing, washing our hands with soap and water for 20 seconds regularly. Where there is no water, we can use a sanitizer. So we have talked about that severally. And as all of you may be aware, our Prime Minister, Mr. Boris Johnson, is now in the intensive care unit, ICU, the intensive care unit. And our prayers indeed are for him, go for him. We are praying for him regularly. He will come around very soon. Now, some may be wondering, what is intensive care? What happens there? The intensive care unit is a unit where we put in patients that have a severe or life-threatening injuries or illnesses. It is different from other normal wards because when you go in there, you have a highly trained physician, a highly trained nurse, and a highly trained respiratory therapist. So yes, these are people who are trained to closely monitor you while you are in there, monitor the equipments for the bodily functioning regularly, monitor the medications given to you to stabilize the person. So yeah, we send in patients who are very unwell. There are various conditions that can send someone into the intensive care unit. One is what we call respiratory distress, where your breathing are highly impaired. You cannot breathe without a machine, and therefore your oxygen level goes very low. Or you have what you call hypertensive crisis, that your your blood pressure has gone so high that it's now affecting your heart and your breathing. Then you have what you call cancer metastasis, which basically means that the cancer has spread so much in your system that it's affecting your heart and your breathing. And obviously, some other life-threatening conditions, such as we have now. Most people are ending up in ICUs with COVID-19 because of breathing problems, because their body cannot maintain the oxygen level. So thank God Mr. Boris Johnson has no pneumonia, even though he's still on oxygen. Now, as per the equipment there, yes, we have various medications which are used to stabilize the patient, either in pain or in distress. We have mechanical ventilators. These are machines that are there to that are put on you, inserted on you with a mask or by intubation to help your body breathe. And obviously, you probably have what you call cardiac monitors. Cardiac monitors are machines that would help to monitor your heart rhythm, your heartbeat. You have intravenous lines put into your veins for fluid and maybe giving you other medications. You have suction pumps. These are pumps that are made to suck out mucus fluid liquid that can clog up, block your airways, your throat, and your mouth. And you have pump syringes. And then you have catheters. Catheters are just like little instruments that are inserted in somebody that cannot pass urine normally, because while you're there, your passing urine may be impaired. Yes, so you are there really for close monitoring. Most times, every person in there has an assigned doctor, an assigned nurse, an assigned respiratory therapist for close monitoring. So yes, this is basically what happens there, and this is basically types of patients that can be put into the intensive care unit. So yes, I hope some of these queries have been addressed so far. We never would end any of our short talks without saying that the only cure and treatment for COVID-19 so far is prevention. So please stay at home, stay in isolation, maintain the social distancing, and please protect yourselves, your family members, your loved ones. Be safe and play safe. Bye.